I did my report on the Guillain-Barre Syndrome, or GBS as I'll refer to it throughout the presentation. Um, Guillain-Barre Syndrome, or GBS, is a serious and life-threatening autoimmune disease that affects the myelin sheaths of the peripheral nervous system. The peripheral nervous system contains all the nerves and ganglia outside of the central nervous system. As an autoimmune disease, the body's immune system begins to attack itself. Guillain-Barre syndrome was first noted by a French physician in the late 1800s. Further, in 1916, French neurologists Jean-Alexandre Barré and Georges Guillain diagnosed two World War I soldiers with this disorder. These physicians noted increased protein levels in the patient's cerebrospinal fluid. However, their cell counts were normal. The absence of pathogenic material in the CSF, along with increased protein levels, led to the discovery of Guillain-Barre syndrome. Guillain-Barre syndrome is particularly disconcerting as the cause of the disease is unknown. However, 2/3 of the cases of GBS occur within days or weeks following infection by the Campylobacter jejuni bacterium in the digestive or respiratory tract. Further, some people develop GBS after having the flu or Epstein-Barr virus. Moreover, people who have had the flu vaccine are at an increased risk of developing GBS. Increased cases were reported. Let me fix my stuff. After the swine flu epidemic in 1976, when people flocked to get the H1N1 vaccine. These vaccine recipients have a higher risk of developing Guillain-Barre syndrome in their lifetime. Symptoms of GBS are subtle and usually begin with a tingling or weakness in the toes or feet. As the disease progresses upwards or ascending, a person will have difficulty walking and severe pain in their extremities that seems to be worse at night. As the patient begins to lose the deep tendon reflexes, respiratory paralysis develops. The disease can be fatal once the disease progresses to the diaphragm. When the diaphragm is paralyzed, respiratory function decreases and the person will die without medical intervention. Patients with GBS see the most significant symptoms between 2 and 4 weeks after the onset of their symptoms, with recovery occurring 2 to 4 weeks after symptoms even out. Now this is only when they start to feel better. Usually full recovery occurs after 1 year, and some people never fully recover. A lot of physical therapy is needed. Guillain-Barre syndrome is not easy to diagnose as the symptoms often occur in a variety of different diseases. Cerebrospinal fluid is collected via lumbar puncture, and increased protein levels without evidence of pathogen is noted. Since the myelin, or the insulation around the axon of a neuron, is affected, perhaps the best way to diagnose GBS is using electromyography. Electromyography uses electrodes placed on different muscles in the body to stimulate and view muscle activity and its response to stimuli. As the myelin becomes more infected, as the myelin becomes more affected, the slower this transmission of muscle impulse. Further, to determine if GBS has progressed towards becoming a fatal disease in an individual, PFTs and FVCs are performed to determine weakness in the diaphragm. Pulmonary function tests. Treatment for Guillain-Barre syndrome is done in a hospital setting so the patient's vitals can be carefully monitored. Also, as the disease progresses to the diaphragm, a ventilator is necessary to help the patient breathe. The best treatment for GBS has been found to be plasmapheresis or intravenous immunoglobulins. In plasmapheresis, the antibodies are removed from the patient's blood, and with IV immunoglobulins, healthy donor antibodies replace the infected ones. According to the CDC, there are an estimated 3,000 to 6,000 new cases of Guillain-Barre syndrome, with 80 to 160 newly diagnosed cases each week. Most commonly, the disease occurs in people older than 50, but can occur at any age. Perhaps the most famous sufferer of GBS was actor Andy Griffith. Some of you may or may not know who Andy Griffith is. In 1983, Andy Griffith was struck down by what he describes as being, quote, one of the hardest times in his life. His symptoms appeared following a bout with the flu when he developed agonizing pain and debilitating weakness that caused him to, quote, fall to the floor in agony. Over the course of many months, Andy Griffith slowly recovered and continued acting until his death at the age of 86. However, the disease left him with permanent foot pain along with emotional scarring. In conclusion, Guillain-Barre Syndrome is a rare but insidious disease. It strikes without warning, regardless of race, age, or sex, so there is not a clear way to prevent GBS. This disease affects the whole body from the feet to the head, taking its sufferers to the brink of death in some cases. By contrast, the majority of people suffering will make a complete physical recovery, yet the agonizing pain of this disease is forever embedded in their psyches. So basically, there is no known cause, so anybody can get it at any time, so be careful. And that's my presentation. Thanks, bye.